Hello, in this module we will see how to handle model diagnosis in cohort study and how to handle time to event data in cohort study. As in earlier modules, we have seen how to handle data obtained from the survival analysis, and in other module we have seen that how to handle data from clinical trials. But when we have problem with combinations of follow up data as well as survival data, that means when we are having some primary endpoints observations, repeatedly observed data as well as death status of those patients also been observed. In that scenario, how to work in cohort study, that we will see in this module. Here we will work with joint modeling, that is with joint modeling with longitudinal data as well as survival data. Here we will see how to do model diagnosis and time to event data analysis in cohort study. In cohort study, we take some group of individuals and follow for long time, maybe 25 to 30 years or more than that, and we follow that some kind of exposure, environmental exposure or behavioral exposure on them, and try to find out this influence of exposure for their specific disease. But in another way, we also formulate a cohort study where we do see a group of patients who are already exposed, and based on this exposure who got disease, and we try to give them some kind sort of treatment and try to find out this effect of treatment to reducing their disease. Any disease can be find out by any specific parameters or more than one parameters, and based on these parameters value with respect to treatment, if this parameter value keep on decreasing or increasing, we can make a conclusion that disease is progressive or not progressing, or it's becoming controlled. So here we will see one kind of data set, in fact two type of data set, where we are having follow up visit of those patients, and based on that how to analyze the data, and in addition before that we will see how to make the model diagnosis to that data set. We will check from the joint models for longitudinal and time to event data with application in R. Here we are going for time to event data analysis, and here we will use two library. One is survival analysis JM, and JM stand for joint modeling. Here since in initial few modules we have seen how to analyze the data, where we are having survival data specifically, and here we are going for repeated measurement or cohort data, where we are having the same patient's measurement on same parameters measurement taken repeatedly over time. So now when we are having two sort of data set, one is the data with time to event data, where we observe the patients at the end of the follow up died or not, or they arrived or censored or died due to some other reasons. This kind of short information is there. And in other type of data set, when we are having informations like the parameters, link parameters like systolic blood pressure, diastolic blood pressures for coronary heart disease, repeatedly measured, and where we don't have any death informations data. But one type of data set may be obtained where we are having both informations like survival informations as well as repeated measurement. In that scenario, we will see how to go for model diagnosis and how to analyze the data. So it's called basically the joint modeling, where we are having survival as well as longitudinal data, also that as synonymous as repeated measurement data. So let's start the data set. Here we are taking the data set from the library JM. The data set name is called AIDS, and when we are calling the aids, like summary aids, we are having these informations like patient, time, date, CD4, observation time, drug, gender and previous observations, AGT value, start and stop date, and as well as event date. So this is a snapshot taken from the R Studio, and we are putting to show these all the data set, because to the parameters are considering the data set at a time. We are using the snapshot here, and it is to be noted that total 375 individuals were there. No, it's a 1400 plus individuals were there, and the minimum follow-up time was 0.47 and maximum was 21.40, and date of those patients are coded as 1, otherwise is coded as 0 if the sensor are alive. And the CD4 measurement of all these patients are considered. This should be noted that CD4 is the one of the biomarker that is considered that AIDS is reducing or not, AIDS is under control or not, that can be obtained by CD4 level. Now these individuals observations time, that is mentioned as waves time, is measured, and minimum was 0 and maximum was 8. Like again, these patients were treated either with DDC drug or DTD drug, and out of these all individuals, 717 patients were treated with DDC and 688 individuals were treated with DDI. Among these patients, 717 were treated with DDC and 688 were DDT. And gender among them, female were 117 and male were 1288, and like others observations. So now we are going for this model diagnosis, where, and before that we want to see these first few individuals data, how it's looked at, and where we are using the function head, and within parentheses we are putting aids. And these, now we have to see these variable having patient, start, stop, event, CD4, ops times, and drug. So, and after that we are putting comma and 7. So 7 individuals observation will be there. Now it is to be noted that, in fact, it will not give the 7 individuals data, it will give these 7 first observations. So it is to be noted that the first patients was 1, and the second row also giving the first patient information, and third row also giving the first patient informations. Fourth row onwards till 7th row is showing the second individual, second patient's measurements. So it shows that the first patient's start was from 0 to 6, stop was 6, and that time no event was occurred, and that time CD4 count was 10.67 with observations time 0 and DDC as a drug considered. Again, for the same patients, measurement time from 6.6 to 12 again considers, because the first row was for 0 to 6 and second row is for 6 to 12, and again that time period follow-up visit is CD4 level reduced to 8.42, and again he was not shifted to any drug therapy, he was also in the DDC only. Now the same patients starting from 12 to 16.97 time period in months is considered. Again his corresponding CD4 measurement in that follow-up period is measured at 9.43. So the first individuals first follow-up times, this baseline CD4 was 10.67, thereafter it reduced to 8.42, and again it increased to 9.43. So that's the individual level observations, and I will take care in this analysis how the individual level information has been considered for this data analysis. And like the first individual, second individuals also having measurement from 0 to 6, again 6 to 12, again 12 to 18, and 18 to 19 month, and their corresponding CD4 is given on column 5 and from row 4 to row 7. So that is the first 7th measurements considered through the function called head. And since this shortage of space, we are not putting the all individuals, so here we are having 1400 plus individuals measurement. Now we will go for how this diagnosis is present. Before that diagnosis can be done with numerically as well as the graphically. First we will attempt the numerical model diagnosis, and after that we will go for graphical model diagnosis. Here this is a code for numerical model diagnosis. Now we are assigning aids.id of aids of duplicates that to these duplicate patient's information has been sorted out, because earlier slide we have seen the same patient's measurements has been taken in different rows. So that duplicates was been removed by these functions called duplicate. Now thereafter we are going for LME fit.aids with the functions called LME and within parenthesis CD4 that I mentioned earlier, that CD4 is the main primary endpoint of interest for any AIDS patients. So now the CD4 is followed to OHT time and interaction effect with OHT time with drug. So we are trying to find out this influence of OHS time on CD4 and the interaction effect of drug with OHS time with CD4. That is our model. Whereas the patient level effect has been considered as random effect, and we have mentioned random equals to follows to OHS time given patients, and data is considered as AIDS. That is one, and these functions result we are assigning here as a LME fit.aids. Now next step, we are not calling these LME fit.aids, so we will use these LME fit.aids later on. Another function we are using, that is CoxPH. This function is useful in library called survival, but earlier function can be obtained from library from LNME or library JM. The LNME function is basically comes from the library called LNME, but in this library JM is also computable. Anyway, we are coming to these functions called CoxPH, and again the CoxPH again with serve we are going for time and date, where we are trying to find out the drugs treatment, that is DDC and DDT, is having any difference effect on their death status of these patients or not. Now we are calling that CoxFit.aids and getting that these regression coefficients for DDT as 0.21 with odds ratio of 1.23, and obviously this is not saying that CD4 level count was quite high or low in case of DDT in comparison to DDC, because the p-value is not coming significant role. However, the odds ratio for DDI was higher than more than 1, so it's not coming lesser than or equals to 1. So we can say that DDI is having higher influence to reduce the CD4 in comparison to DDC, but since p-value is not significant, we can't say it's a significant improvement. So now we will go for something modifications here, where we are using, in addition to CoxFit.aids that we have seen earlier, we are going for another function called joint model, and into joint model we are calling these LME fit.aids that we have put earlier before the CoxFit.aids. Now we are calling this LME fit.aids, and CoxFit.aids also assigned with as a time variable obs times, and method as a piecewise proportion PH is considered. Now the plots, we will be having 4 different plots. To show the 4 different plots in one window, we are calling this called PAR of MF row equals to C of 2, 2. So number of row and number of column will be 2 and 2. So that is we can use to assigning to C number of rows, different number of rows and different number of columns in a specific R window. Now when we are calling this plot joint fit.aids, we will see the graphical expression of the data, and we will see the residual plotting as well as PQ plotting, and how this data is suitable for parametric approach, that we will see. So basic intentions to use two function, one is cox fit.aids and earlier one is LME fit.aids in one single functions, that is joint model is there to run both things simultaneously, to run both survival as well as longitudinal repeated measurement same times. So here CD4 level count is considered as repeatedly measured, where date of this patient has been considered only as a single term. So when we are having this kind of cohort study where we have to see some individuals patients for a repeatedly follow up, and after that we are having some date and some of them are not died, and this sort of informations can be handled with these joint model functions under the library called JM. Now we will see the plot, how the plots are shows. Since we had put power of MF rho C of 2, 2, here we are getting four graphs simultaneously in one window. So first row is showing residual versus fitted, where the y-axis giving the residuals and the x-axis giving the fitted value, and it shows the red line showing the spline value of this fitted residual is around 0. So residual is very good, so you can say that there is not any higher residual value in this data set. So data is having very influencing data. Now in the second column, first row, we can see this the plotting of the normal QQ plot, and this normal QQ plots looks like it's absolutely following the normal distributions. So as of now, whatever we have considered that CD4 counts data is following normal distributions that can be obtained by QQ plot. Now the first column, second row, showing the marginal distribution of the survivals, again shows that as time increases, survival of those patients keep on decreased, and after 20 months it reduced nearly 40%. So if we look on the y-axis, it shows the value started from 0 to 1, and x-axis giving the time of the measurement in months. So it started from 0 to 25 around months, and it shows that as marginal survival of those patients as increases, time increases, is decreased. And alternatively, these cumulative hazards, the cumulative proportion of those hazards of those patients also increase as time increases, so that touch to nearly 1 at the end of 25 months. So from this plot, we can state that this model is having good parametric choice. The parametric model can be selected for this, and seeing the residual and the normal QQ plot is following normality, so we can say the data is follows normality, and that is the way to diagnose the model. Now once the model diagnosis is done, now we will go for second approach, that is model predictions, and these model predictions obtained from this is given as the function of residual, and within joint fit.aids, and with process of longitudinal you are using, and type as selection as a marginal. So marginal fitted residual will be obtained as res mark y.aids. Once we call the res mark y.aids, then we will get the predicted value of res mark.aids, and after that when we are putting the fit marks y.aids, then with the functions called fitted, then we will get the fitted value for all these 1400 plus individuals. So this residual measurements and fitted measurement for each individuals can be obtained by these functions called residual and fitted. We may get that data. Again, for shortage of space here, we are not showing these data results here, but now once we are getting the regressions, res marked y.aids and fit marked y.aids data, then we can compare, and again these that can be plotted here. You can see how the regressions fitted value plotted into the graph, and how the residual value plotted in the graph. So this is the one way for my model diagnosis getting the model diagnosis predictions. And now we will go for The second way of objective, that is to capturing the inference about the time to event data analysis. So time to event data analysis plays role when we are having repeated measurements of these individuals, and after that some certain time these patients were having death status. So this data is pbc2.id. id is considered that it is on primary biliary cirrhosis data, where under the, and this data is also available in the library called JM. When we are calling the data status as .numeric, we are putting pbc2.id. for those that are having status alive, they is only considered as status 2, and after that we are calling this Cox fit as the function of Cox pH, where sharp of years and status 2 follows by drug and age and sex is considered, where data is equal to pbc2.i has been called. Now we are calling this summary fit of Cox fit. So this is the results obtained by Cox fit, where this formula is sharp of years and status follows to drug, age, sex is considered. So here the factors of drug, that is what are the treatment given to those patients, either placebo or interventions is considered here, and again age of those patients is considered, and the sex of those patients is being considered. So we have seen how the coefficients value changes over there. We can see that drug D penicillin is having negative coefficient segregations value with odds ratio with 0.87. So it's having lesser. Those who are treated with penicillin, they are having lesser death kind of informations can be obtained. However, since p value is greater than 0.05, so we should not consider as a significance measurements. In case of age also, however, age is having p value significant, and the coefficients is exponential of coefficients is coming as 1.02. that is, we have earlier mentioned that exponential of coefficient should be considered as odds ratio. So again, those that are having higher age groups is found with more death in comparison to others. And for the female is again found out that coefficients coming minus 0.49 with again odds with 0.61 and p value with 0.01735. So again it's a significant p value, and again says that those who are having female, they are having lesser chance of being die in comparison to male. So now these the same results can be obtained with these lower and upper confidence intervals that given as for drug D penicillin is coming lower confidence interval, obviously 95% lower confidence interval coming as 0.64 and upper confidence interval is 1.18. For age it is coming 1.0064 to 1.0373, and for female it is coming 0.4067 to 0.9168. And concordance index also been measured here, is obtained as 0.573, and R square value is very low and is coming 0.04. So and maximum possible value is mentioned as 0.996, and likelihood ratio is coming, p value is coming. So likelihood ratio state that p value is significance, and word test also saying that p value is significance. So this is the inference about the model where we are going for relevance of this age, drug and sex on their death status and assigning through the function called survival. So this is the one approach to handle with these longitudinal or repeated measurements into the cohort study, and this can be suitable for in RCT setup where we are having randomized patients into 2 or 3 groups and see them through follow-up period. As well, this kind of data analysis is suitable for case control study where we are having one group of patients treated with cases and another with control, and as a measurement the biomarkers are considered repeatedly over times during their follow-up visits, and as well as their death or alive status is considered as a status. So when we have certain kind of applications or feasibility or data is there, then we can go with the joint modeling approach, where we can at a time we can go with longitudinal data analysis as well as the survival data analysis. I hope this will help you further for doing the case control study as well as cohort studies setups for these analysis. Here in this module we have used two packages, library survival and library GM, to analyze data for cohort study. We have also seen how to work with model diagnosis as well as time to event data analysis observed from cohort study. I think this module will help you for further work when we are having data with follow-up observations and as well as survival status of patients informations.